Thank you. Hi, Dr. McWan.
Sure. Hi, how are you?
Hi. So I'm Dove 11, and I'm the National Senior Director of Program Management and Education, and I'll be moderating today's session. Sorry for the late start. We had a little technical issue. Before we get started, I'd like to share a few housekeeping items. Please submit your questions via the Zoom Q&A icon located on the Zoom menu bar, and we will answer them during the Q&A section. You can submit comments using the comment icon located at the bottom of the Zoom menu bar as well. Today's session will be recorded and available online. Dr. McWan is board certified in neurology and neuromuscular medicine and has been practicing neuromuscular medicine at Eisenhower Health in the Greater Palm Springs area for 10 years. He is a member of MGFA's Partners in MG Care, and also a guest speaker at the national conference. Dr. McWan regularly speaks at our Southern California support group meeting. Dr. McWan will start in just a minute. I wanted to remind everyone that we have our national patient conference coming up February 10th and 11th, and registration is open on the MGFA website. We also would like to thank our sponsors, Alexion Argenx, Janssen, UCB, and Horizon. I'm going to turn this over to Dr. McWan, and let me give you permission. You can probably go ahead and share your screen, Dr. McWan.
Okay, sure.
If you go to the bottom, it says share screen. There we go.
Okay, very good. All right, thank you. Thank you very much, Ms. Levin, for the presentation. And I wanted to thank you all for joining this afternoon, whatever time zone you are on. I think almost all of us now are in, it's afternoon to all of us. So sorry about the delay. We had a little technical difficulty here. So we are going to talk about managing and coping with chronic disease. That's the topic that I'm asked to give a talk on. Myasthenia Gravis Foundation of America, and I'm going to touch on the Myasthenia Gravis and the whole situation. So living with chronic disease, and according to one survey, almost 50% of population in United States is living with some chronic disease. It can be hypertension, it can be diabetes, it can be arthritis, or cancer, or some sort of heart diseases. So huge amount of folks, yet they have been living with it. And there are a few things that's important to live with a chronic disease. Most important thing is to understand the condition. Having a good understanding about the condition and the disorder, that does help enormously. And as a result of that, one can become a self-manager. Managing emotions, that's extremely important, because we know that there is something going on. There is a chronic disorder. That's what we are going to battle throughout the life. And managing emotion remains extremely important. At the same time, managing relationships, the loved ones that we have been living with. Can be spouse, can be children, can be friend. It can impact the relationships. And most important thing, that develop adaptability, having a new normal, because life does not remain the same as it used to be. So development of adaptability is also very important. I'm going to touch on a calm model, and I was going through several lectures. They have been done over the course of past year and a half. And the fascinating lecture that I saw, that was from late Dr. Nancy Law. She did it early part of the last year. We do appreciate her enormous contribution to the Myasthenia Gravis community. She was the CEO of the Myasthenia Gravis Foundation of America, and she does talk about the calm model. I'm not going to go over it today. It's already there on the website. And these are the 4 things, and that's how the calm model that has come into play. She does talk about the app on the phone also, about the calm model and how people can utilize that. And what calm model is the change, because there has been a change. So that comes to the adaptability that if it does change one's quality of life, or having a diagnosis, it changes, or it can change anybody. And acceptance, that's important, having a new normal. And let go, that's L of the calm. It's also important because folks get frustrated that why me? Why has that happened to me? And understanding it and just accepting the reality and let go. And then managing lifestyle. So that's the M there. So calm model, it has been there. Most of you would already have watched it, or if you can go back and take a look at it. It's a fascinating talk that she has done. It was during the early part of the last year. So what happens that there is a distress which is associated with chronic disease. And the slide does talk about the distress, which can lead to emotional burden, because that's having a diagnosis that can create emotional burden. It can vary from one individual to the another individual. Having chronic disease, then there is a management plan, and the provider, the doctor, the physician, or a practitioner can bring up the regimen. And a regimen can be diet, but the most importantly, the regimen can be medications. And regimen, the medications, can also lead to distress. Oftentimes, there can be stress between patient and provider. Folks may not feel as comfortable with the provider, or we as a physician, oftentimes we run in a busy practice. And today, I'll give you my example. I had this one patient, I was running quite a bit late, and she had a few questions. I was hoping to finish visit a bit quickly, but she had few questions, and this is what I asked her. I said, I've got to get on through the program. If you want me to answer those questions, if you do not mind coming back after 1 o'clock, I can sit down and address those issues. But the bottom line is that we as a physician, we get so busy, oftentimes folks may feel that they are rushed in, and it can lead to patient-provider distress. So that's And that can pile on the whole situation. And social support distress. It can lead to distress with the social circle, the folks that we hang out. And oftentimes we have to say no, or we may not be able to participate in some activities or some gatherings as a result of the chronic distress. And the whole situation total, that all these situations can create a huge burden on one's quality of life. So my topic is managing and coping with a chronic disease, but this is Myasthenia Gravis Foundation of America. We are here. Majority, almost all of you are here because of the Myasthenia Gravis as a condition. And as you know, it is an autoimmune disorder. It does affect the muscle and nerve junction. Whenever there's the problem is here, the connection between nerve and muscle. It is an antibody-mediated disorder. And I'm going to go very briefly that our white blood cell counts in the body, they have B cells and T cells, and that's the immune response. And it's very important that we talk about it. You all have been hearing about this for a while, but we are now going into the third year of pandemic. 2 years ago, back in March 2020, we all were thinking that this was going to be over in few months. Majority of us were hoping. Maybe last year, we had the same thought process that probably by the end of the year, things would be better, but it's not getting better. Now we have a new variant, and it has created enormous amount of stress on individuals. Not a single one has been spared. And specifically when folks do have chronic disorders such as the Myasthenia Gravis, it can add a lot of stress, and all of you have been dealing with it for past 2 years to various degrees. So if we go back to immune system, as you all know, when the pathogen or any pathogen that attacks the body, our body has the white blood cell counts, and white blood cells have T cells and B cells, and T cells, they do get activated in the lymph nodes or bone marrow, and they also fight against those pathogens. And this is like a tag team response. They also activate the B cell, and B cell, they do produce the antibody, and antibody also fight against this pathogen. And then there is a memory response in the T cells, and that's how the immune system gets activated. And this is how the whole concept of the herd immunity that we all have been hearing for the past 2 years, that yes, these T cells, they are like memory cells. They remember that pathogen. In this case, our common enemy has been now the coronavirus. So I think that's what everybody has been hoping to some extent with the vaccination and natural immunity. So what happens that we have these antibodies here. We all have antibodies in the system, and this antibody sometimes perceives body's own cell as a foreign objects, and they can attack the body's own cell. And here in this case, they are attacking the muscle. And that's how this autoantibody, that's what leads to the destruction of the muscle. And as a result of that, there are two types of folks. They categorize myasthenia gravis as seropositive and seronegative folks. Seropositive, that's where the acetylcholine receptor antibodies come into play. That's where 80 to 85% of folks have that acetylcholine receptor antibody positivity, 5% of anti-MuSK. There is another antibody, LRP4, but 10% of folks do have the status called seronegative. That means they do have antibodies in the system, but they have not become commercially available. And as a result of that, those folks, about somewhere between 7 to 10% of folks are under the territory of seronegative. And there have been some new treatments. They have been coming out, and oftentimes the labeling indication does come in favor of seropositive, acetylcholine receptor positive, and the folks who have seronegative status or anti-MuSK or other antibodies, folks can be discouraged, and that can lead to some stress that, well, why we are being left out, and that can lead to some stress-related situation. So exacerbation, that's what I'm going to talk here. I'm going to switch gear right here, but what happens that you all are very familiar with it, myasthenia gravis exacerbation, whatever the baseline symptoms are, it can lead to exacerbation, and there are 4 different things that can cause exacerbation. And one is infection, any sort of infection. It can be upper respiratory infection. It can be urinary tract infection. So that's infection that can lead to myasthenia gravis exacerbation. Some medications do also play a role, and medications can also lead to exacerbation. I'm not going to get into the whole list of the medication. Myasthenia Gravis Foundation of America has laid it out very well on the website. And 2 other things that can also play a role with myasthenia gravis exacerbation is psychopathology. So that's what we are going to look into it. And the number 2 is personality and coping mechanism. So psychopathology, personality and coping mechanism. So infection, medications, those 2 are, we are quite a bit aware about it, but the psychopathology and personality and coping mechanism, that's what we are going to touch on it later on. And you all are very familiar with this. It is an unpredictable disease. Every single individual is different. When we started our support group, that was back in 2019 here in Palm Springs, July 2019, one of our members, he coined the term then that let's name it as a snowflake disease. So it has unpredictable course. It has relapsing and remitting course. And there are medications, the chronic medications. This is a treatable disorder. And oftentimes your neurologist may tell you that, yes, this is a disorder which is very treatable. We can help you a lot because we do have a lot of other disorders, neuromuscular disorders, specifically neuromuscular medicine. That's what we practice. And a lot of those disorders do not have treatment available. And here we have platform therapy, and we do have several options available. However, one has to be on it for quite some period of time. It can lead to side effects, and there are other logistics associated with that. And if we put all these things together, it can lead to psychological stress, and it can predispose to the mood issues, and it can cause depression. So that's the situation with myasthenia or with any other chronic disorders. Now, what are the symptoms of stress? Again, I'm going to go back to the nice presentation of our Dr. Law, what she had done. I'm not going to get into detail, but she had laid out these 3 symptoms of stress really, really well. And again, I do encourage you guys, if you have already seen it, you can go back and please take a look at it. But there are physical symptoms. It can be gastrointestinal disturbances. It can be back pain. It can be neck pain. So physical symptoms of stress, they are there. Emotional symptoms, they have been there. It can cause mood issues, stress, anxiety, and intellectual symptoms of stress, difficulty with concentration, trouble with performing certain tasks. And nowadays we all do multitasking, and it can create issues. So these are some of the symptoms of stress. Fatigue is the most common. It is very, very common symptoms in myasthenia gravis, and fatigue can take a toll on folks with myasthenia gravis. It does vary from one individual to the another individual. And I put that in the slide, fatigue and sleep together. Myasthenia gravis, the disorder, it's a muscle disorder. The hallmark, as you all know, it has a fluctuating course, and folks can have good day or bad day, good time or bad time, good hour or bad hour. And fatigue can impact one's quality of life to various degree. And the question that I do ask them, the sleep pattern. Sleep hygiene is very important. Again, there was a talk last year on the sleep and myasthenia gravis. Dr. Desai had done it. I did take a look at it also, and I'm not going to get into detail because the presentation is already there. The sleep pattern plays an extremely important role. In adults, after the age of 65, the studies have shown that folks would need somewhere between 5 to 8 hours of sleep. Other than that, more than 7 to 8 hours of sleep, which is very, very important. Having an adequate sleep is very, very important. If one does not get enough sleep, or if one has trouble with falling asleep or maintaining a sleep, that can lead to excessive daytime sleepiness. And folks can have significant fatigue, trouble concentration. So sleep hygiene is very, very important. Oftentimes, having evaluation done by the clinician for any sleep disorders such as obstructive sleep apnea or other sleep disorders. So they do play important role, and it's very, very important that we look at the fatigue very closely, very carefully, because almost all the folks do get it, and it can lead to huge impact on one's quality of life. As a result of that, one has to adjust the lifestyle. Certain activities cannot be participated, and again, the schedule can be managed. based upon the symptoms of based upon the severity of fatigue that one has. So managing and coping, we have several ways. And one of the important ways is emotional way. And talking to the provider, talking to the clinician is very important, spending time with the clinician. And as I've said, I'm also guilty of that situation. We all, we run into oftentimes busy practice. We tend to run behind at times, and we may not be able to spend time. If that's the case, try to be upfront, let them know we are here. I would like to discuss several issues. And most important aspect is besides the complaint, besides the trouble that one has been having, talking with the doctor about the situation, what has been going on emotionally, and bringing clinician to your side, it does help enormously. If there is significant stress, anxiety, mood issues, be depression, having some sessions with the therapist, which is very helpful. Oftentimes, therapists may recommend evaluation by a psychiatrist where medications can be offered, or therapists may recommend medications and that can be offered by the primary care physicians. And incorporating healthy habits, that's also important here. Managing stress can be challenging, but there are several ways to manage stress. To some people, prayer plays a very, very important role. Some people do believe in meditation. Meditation can also be done to manage stress. So there are several ways that emotional aspect can be handled. Physical aspect is very important. Change in diet. So oftentimes, because we are here and talking about the myasthenia, and as we all know, it can lead to trouble with chewing, trouble with swallowing in some individuals. And if that's the case, changing diet regimen is important. It can take, when one has trouble with chewing, it can take a little longer time. So adjusting diet is important. And of course, the healthy diet is quite a bit important, and you all have heard about it. I'm not going to get into detail, but the low salt, low sugar diet is always good. High amount of or adequate or slightly more than adequate amount of protein, that's important. Changing lifestyle is also important, and exercise do play enormous role. Now, one can do certain exercises, and of course, the myasthenia gravis, it's a disorder of the skeletal muscles, and it can create the fluctuating course, and occupational therapists and physical therapists, they can help us out with the physical therapy situation, what type of exercises can be done, what exercises cannot be done, the amount of time. So bringing physical therapist or personal trainer on board can be very helpful in this situation. Another very important aspect is social aspect. we human being, we are social animal, and we have realized that much more over the course of past 2 years than when we did before. And having family and friends, letting them know about the situation, it does help enormously. Of course, spouse play a very important role. We call them the caregiver or whatever name. But they are the provider. They are also provider here, and bringing them on board. And there have been a lot of discussions happen about the caregiver and the whole situation. I'm not going to get into detail, but that talk is also available on the website. But family and friends, they play enormous role. Support groups have been amazing. Myasthenia Gravis Foundation of America has done a fantastic job about the support groups throughout the country. I've seen them here in our local area. The support group, they play very, very important role. And for the past 2 years, the gatherings have been happening online. But when back in the days, I remember when we used to get together here in Palm Springs, our support group leader here, Connie, she would do a couple of sessions, one with just the folks, another one with the caregiver, and having support groups or being a part of a support group is extremely important. Online communications have always been helpful. We all can gather a lot of information on online communications, and we all have to be oftentimes. It can happen through social media, and you just have to be slightly careful about that online communication, because so much information can be given, and some of them may not be true. So verify some of those information through the support group. That's what I do encourage. And as I've said, yeah, the Advocacy Myasthenia Gravis Foundation of America is also an advocacy group. It has the enormous website, so they also do play. So as we did talk about the managing and coping, and it's a multimodal approach. We'll get back. The myasthenia gravis is an antibody-mediated disorder. It is a treatable disorder. We can help out a lot to the folks. There have been several tools available. There have been medications available. So that's a bright light here. We have got so many therapies available. New treatments are coming out. There are few treatments in the pipeline. And so the medications, that's the pillar of the treatment, very, very important. However, the medications can have side effects, and the therapy can create other issues. So that can lead to psychological burden, that can lead to emotional distress, and managing that is extremely, extremely important. And we did talk about several ways, as we did discuss earlier: the emotional way, physical way, and the social way. Those three, that's a three-pronged approach, and no one is interchangeable. They all play extremely, extremely important role. And such a type of discussions are very, very important to understand the disease. support groups, Myasthenia Gravis Foundation of America, they do play extremely important role to understand the disease. We did talk about the medication. So what we have, the therapy available. And then there are certain medications that cannot be used. So having a knowledge of those medications, that's very, very important. And aside from medication, as we did talk earlier, the three-prong approach, which is emotional, physical, and social. So this three-prong approach plays important role in order to, or important role for management of chronic disorder, coping with chronic disorder. So I want to thank you very much for your attention, and we will address the questions that's going to come. So please, yes, thanks. I'm going to give back to Ms. Levine, and we'll go from there. Thank you.
Thank you, Dr. McQuan. I am just going to show one slide before we go to question and answers, because I did not show it before. I just wanted to thank our sponsors, Alexion, Argenx, Janssen, UCB, and Horizon Therapeutics. I'll stop sharing. I will stop sharing now. We'll get right back to this. And I do have some questions that have come in. The first question was, do you know the name of the CALM model that Nancy Law had put in her presentation? If not, we can find it and send it out to people. I just didn't know if you knew the actual name. Somebody was asking.
I didn't. It's right. It's the name. It's during the first slides that she has put there. It's just CALM. That's the name in the
CALM.
app.
Okay.
Yeah, CALM. Yeah, just a CALM model. CALM, the CALM model, and she already has that on one slide. And I think the app is also available for the CALM model. Sometimes folks can go through the smartphone and download that, but it's just a CALM. Yes,
okay, perfect.
As you said, yes. Thank you.
Someone else is asking what your opinion is on meditation or yoga to manage stress.
It plays an extremely important role, meditation and yoga. Some people can do that really well. If you feel comfortable doing meditation, it does help enormously. Yoga has some role, yoga and meditation. So they both are extremely important to manage the stress. And we have had good data available. And if one can do that, it's definitely helpful. Not everybody can do that. I'm very clear. And I'm not saying that one must do it, but if somebody who feels comfortable or has been able to do that, you can continue with that or try that. Again, as Dr. Law said, she on that lecture, she said, I myself cannot do the meditation, so it's not an option for me. She was she herself was very upfront about it. So if one doesn't feel comfortable, cannot do it, you don't have to. So yeah, thank you.
Thank you. So someone's asking that, I'm going to summarize because it was a long question, but basically they're saying they're getting very stressed about the virus, in the fact that they want to be with people, but they don't want to be they want to be safe and not be with people, but yet they want to be with people socially, and they just get into a position where they don't know what to do. How can they be safe, but yet socialize? So the person says it's becoming very stressful for them.
That's an excellent question. and you are not alone. A lot of folks have been going through it. Unfortunately, as I've said earlier, we are going into the third year. Right now, in certain areas, the peak is going up. In some parts of the United States and Northeast, the data that we have been seeing that there has been steep decline. South Africa, where the Omicron variant was emerged, we have seen data from there. There has been steep decline. So that's a good news. One can contract very quickly, and there is a very quick spread here. But there have been some good news, and I'm not going to get into detail, but what we have been seeing, as a matter of fact, we all know that nobody is quite familiar, 100% familiar with it. What we have been seeing, we have seen few things over the course of past 2 years. We have been seeing data, and so far, the severity amongst the vaccinated individual is not that high, specifically with Omicron variant. So that's positive thing. That's what we have been seeing. There have been some data that after vaccination, if one gets Omicron, there is a good likelihood of having good, there is the high immune response, but again, we don't have a lot of scientific data available. Getting back to your question, it's very important. Yes, I would like to socialize with somebody again. The fundamentals have not been changed. Mask is very, very important. Mask does provide some protection, although we don't have solid data available, but mask, double masking, or having N95 mask, which is not easy to wear. I have it here in my office, but this is very, it provides the highest level of protection here. I wear it in my clinic oftentimes when I do procedure, but it's tough. It's not easy to put that on, but this is something that does provide the highest level of protection. So if you want to gather with somebody, or if something, because we, as I've said earlier, we human beings we are social animal, and interacting with the loved ones or interacting with our friends is important. So if there is situation outdoor, if the region, and again, there is a cold wave, I think, going on in the Northeast or Midwest, so outdoor gatherings, that's not possible. But if you want to try maybe little outdoor gathering, short meetings with social distancing, that's something that can be done. And then, because again, if you don't see loved ones, or if that's something, if something, it can lead to huge stress. It can lead to anxiety, and it can create issues. So I'm not saying absolutely. Again, there are two ways. That the way not to contract. That's what I've been telling all my patients. The best way not to contract is to hunker down 100%, but that's something hasn't happened. It's not possible. There are two. One of the ways is what happened initially back in Wuhan. That's where it was originated in China. It was 100% lockdown. But it's just what we have learned. It's not possible. We all have to leave the home, or we all, to some degree, we go out anyway to grocery store, doctor's office, physician's office when we need assistance, because screening is very important. Unfortunately, a lot of screening, which is important, cancer screenings, they were delayed, and I had seen some folks that having their diagnosis delayed because of not having certain visits. So we all are walking a fine line, and you are not alone. The whole world, of course, both southern, northern hemisphere, eastern part of the world, western part of the world, we all have been going through these challenges, and we can just navigate it and then go from there. So thank you. Yeah.
Thank you. So we've had these, we've been doing these webinars for many months during the pandemic, and the advice has been from all of the doctors that we've spoken to for the myasthenia gravis patients, get the vaccine, get the vaccine, get the vaccine. So now so for those people that may have not gotten the vaccine, this question comes up. Is there any evidence that the vaccines can cause a myasthenia exacerbation?
Very good question. Thank you very much for putting that question. Yes, so far, we do not have any evidence that vaccine can cause myasthenia gravis exacerbation. It's an mRNA vaccine for a few days. It can cause some issues, couple of days. And I'll give you one example. Whenever we have anything like the vaccine is administered to the body, the goal is that the body produces immune response, and the body gets shaken up for a day or two or a couple of days. And that can lead to some stress or anxiety, and that one may feel that, well, I'm having exacerbation of the symptoms. I've had some chewing problem, little swallowing issue that I've been living with it. Now I had the vaccine, and now what has happened? But those responses are transient. To this date, I'm very clear to this date, we have not seen any issue, any response or exacerbation of having or myasthenia gravis exacerbation from vaccine. So I do completely agree, as Ms. Levin said, yes, vaccines do offer some protection. Again, it is very debatable on how much longer it would provide. Again, booster dose that came out, third dose, and we don't know. And folks who had 3 dosage, and they are also contracting COVID, but the severity is mild. And one may get the idea that, okay, well, if you get vaccine and still you're and then still we are contracting it, what is this worth it or not? But this is what the data have shown, that it can lead to the minor symptoms. So to answer, yes, I completely agree with what the other presenters have said over the course of past little over a year. Yes, thank you.
So, we always, no matter what our topic, we always go back to COVID because that's what's on everyone's mind.
Yes,
and so, a few questions.
Yes,
yeah, of course.
This is it. It's COVID time. 2 years ago, yes, we were thinking that this was going a few months, and it's just not going away. And again, it's not as much as we all want to believe that it's going to go away. It's not. We have to live with. We are living with it. Yes.
Right.
Yes.
There's a few questions asking, do you think there will be a 4th dose or another booster?
It's a possibility. We are looking at a lot of data from Israel, and Israel has approved the 4th dose on individuals over 65. So that possibility cannot be ruled out. We don't know anything concrete yet. So
okay. Well, we have one more time for one more question.
Yes.
And now this one's a good one. So the patient says they take IVIG. They have the IVIG. Is it possible that they're getting COVID antibodies in their IVIG because of the people that are donating plasma?
That's a very good question, and I'll answer. Let me answer it that way, because IVIG is made up of tens of thousands of plasma donors. It is purified. It has been looked carefully, and then it has been infused over the course of several hours. So it's an immunoglobulin, intravenous immunoglobulin. Some folks can get it subcutaneously, essentially the immunoglobulin in the system. And the thought process is that, yes, when one acquires COVID, the coronavirus or any other infection, oftentimes the cytokine response that gets activated, the cytokine storm that can happen, and that can impact the lungs. And that's when the whole situation, the breathing situation, the lungs, the pneumonia, the respiratory distress, those IVIG, so that can happen. But IVIG, so immunoglobulin is there, and immunoglobulin can help. It can help against those cytokine storm. So that's the role. Now the question is that, let's say the plasma which was donated, and if they had COVID or if they had antibodies, my understanding, I think, before they donate the plasma, yes, they typically do testing and make sure. So of course it's not active. Now, we don't know, we don't have the data available at the moment, whether folks who had COVID or if they had antibodies in their system, how the process was done. So the answer is I do not know. We do not have the data available at this point, but that's something to look, and we'll check. Yeah, thank you.
All right. Thank you, Dr. McQuan, very much for your talk today. And thank you, everyone, for participating and for asking questions. We had a lot of questions today that we couldn't get to, but we will try to get those answered for you. And we really appreciate your time. And everyone, don't forget, we have our national conference coming up February 10th and 11th. You can register on our website, myasthenia.org. So we hope to see you all there. Have a good day.
Thank you. Thank you. Thank you.